Hello, viewers. Today, in another session of Health Forward, we have a very distinguished guest with us, Dr. James Merlino, Executive Vice President, Chief Operating Officer at Joint Commission. Dr. Merlino is just not a doctor. He's actually a magician, and I will let you know why I'm saying that. Who has actually changed and defined patient experience and what is it all about? He's been doing a lot of work on patient safety quality across the world. He's also an author, written many bestsellers like Service Fanatics and Zero Harm. To be very frank, just an information for all the viewers, I actually got to know more about him when he joined JCI, and I kind of looked about his profile, and I was so drawn towards towards the articles and the books that you have written. I am serious that I bought both the books. I read the complete book Service Fanatics on a flight. I mean, multiple flights though, but I did manage to do that, and it was really interesting. There was a great learning, and actually I did imbibe a lot of those learnings in my daily experience. So thank you to you, Dr. Merlino, for that. A very warm welcome to this podcast to share your learnings and experiences with our audience.
Well, thank you very much for having me. I am absolutely thrilled to be doing this and also participating in your upcoming conference, which is really a beacon for safety and quality and healthcare not only across India, but across the world because of the audience that you draw and the information that you provide. So I'm honored and privileged to be participating again. And thank you very much for your warm introduction and recognition. I think you have raised the bar a little bit on who I am, but thank you very much. I definitely appreciate it.
Thank you. So Dr. Merlino, I think all our viewers would be very much interested in learning a little bit more about you. So if we could take us back to the early days of your career, what actually was most interesting that kind of has drawn you into healthcare, and which were those experiences of yours that actually shaped that whole direction that eventually took as a healthcare professional?
I've always wanted to be a physician, and I was always drawn to this idea of helping people. And early in my medical school career, getting exposed to different specialties, I found surgery to be very interesting. I felt you could fix a problem, you could help people. And I also felt the importance of the medical specialties where you're taking care of people longitudinally. Ultimately, there's a couple specialties where you can do both, take care of people for a long time and also do surgery. And one of them is actually colorectal surgery, which is what I am. I'm a colorectal surgeon. My career and interest in patient experience specifically and improving life for patients obviously is grounded in what I do every single day. But it really took a turn when I was helping to take care of a patient a long time ago in the hospital, and I just left him, and I get a call while I was at home telling me that the patient had arrested and died as a result of a complication. I went back to the hospital, and we've all been to those scenes in a hospital where a patient passes, where the nurses are surging to help their colleagues, and there's a lot of activity going on, and the family's there. And it was a very surreal moment for me because what had happened was that the person that died that I was helping to take care of was my father. And I'd never been on the other side of healthcare before. I'd never been a patient. No one in my family had been seriously ill. But having the opportunity, not really an opportunity, but the misfortune to help take care of him as a caregiver showed me what it's like to be on the other side. My father died of a preventable safety error. He went in for an ambulatory procedure, he had a complication, he stayed in the hospital and ultimately succumbed to the complication. And that taught me two things. Number one, that it's different on the other side, and we all shouldn't need an epiphany to recognize that, right? What patients go through is very important, and sometimes we lose track of that because we get so caught up in the delivery of healthcare. The second thing is that we need to do more for improving safety and quality. And the world has made tremendous progress in that initiative, but we need to do so much more because there's so much more that needs to be done. Because every day around the world, we're not doing it on purpose, but patients are suffering safety events that cause harm, cause complications, cause death. and that's not right.
I think that was a very difficult learning, I'm sure, and I did read about it because I think again I'll keep harping on the fact about the books that you have written, but then you very beautifully described your learning there, which is definitely a motivation for a lot of people to understand and see where they can draw their experiences from and what is it that they can learn and bring into real time. As I said, it was a very difficult learning for you, but the kind of impact that you have made based on that, I think that really makes a lot of difference. And you are actually right that there a lot of these errors happen, but then a lot of times we either don't identify, we are not able to note that point in the error in patient's journey, or if we know, we don't end up taking enough actions or getting to the root cause of the problem, why it happened, so it never happens again. So I think it's broken at multiple places, and that's what we as healthcare leaders need to really work on.
I think you're absolutely right. The process of fixing safety and quality is difficult, and it's not just one thing, right? I think when an error occurs, we have a tendency to look at it, dissect it, do the root cause, and then try and improve something. But what we fail to recognize is that really the application of elements that need to be done to improve safety involve a lot of things, whether it's facilities, technology, process is certainly one. It could be policies, but also culture and leadership. If you think about high reliability science, for instance, a lot of failures occur at the cultural and accountability element. And we need to work on getting our people up to speed, teaching our people how to be thinking about the prevention of safety errors as opposed to just the recognition of safety errors. Gaurav, at the end of the day, this is something that affects all of us. It's not just the people we're serving, but it affects our family members. It affects us personally. And so it's very, very important that people recognize that.
And I think again, I'm sure this was one of those pivotal moments, that really influenced largely the leader that you are today. So really, thank you so much for sharing that experience and that part of your journey with us. Moving on to a little lighter note, what's the funniest or the most unexpected compliment you would have ever received in a professional setting?
Oh my goodness, that's a difficult one. The funniest compliment I think I've ever received is, I'm not sure. I don't take compliments well because at the end of the day, I feel that, I'm in the service of people. So I can't think of something that was really funny. I apologize. I have to think about that. It's a great question, though.
That's okay if nothing actually comes to your mind as of now, but I'm sure you have dealt with so many patients, and the impact that you have made. I'm sure there have been greater compliments for the work that you are doing. So we'll probably take it with that.
Can I share a serious compliment?
Please.
So I was I took care of a patient, a young man. He was 38. He had a wife and 3 beautiful girls. They were very young, 3, 4, and 6. And he died of a complication in the hospital. And it was a very unfortunate complication, and it wasn't related to a surgical outcome. It was related to a condition that he had that caused his heart to fail. And it was a tragedy because all deaths like that are tragedies. But the best compliment that I've ever received in my career is, and I still have that picture of those 3 beautiful young girls who now are probably in their 20s, emblazoned in my mind. But the best compliment I ever received is when his wife said, "You took the time to know my husband as a person, not just a patient." And I'll never forget that. So it's not a funny compliment, but it's the most important compliment that I've ever received in my career.
I completely agree with you, and I think it's a very, this line what you just said has got so much of depth in it, which we don't understand in our day-to-day work, day-to-day hustle. We go to work, we have tons of things to do, priorities sometimes keep changing. Sometimes we just don't end up considering patients as patients. they are like a part of a regular journey that you're just getting through. And I think a great learning that you shared on that front. So you have really worked for long at Cleveland Clinic and now with the Joint Commission. So what do you think are the most urgent shifts that the health systems must make to strengthen the quality and safety in a lasting manner?
Sure. I think it's two things. Number one, it's culture. At the end of the day, it's our people that really drive the work around safety, quality, and experience for patients. And if we don't have our people aligned around that goal and actually working towards it every single day, we will never accomplish, what we want, what we set out to accomplish. And if you think about the stresses on healthcare or professionals around the world today coming out of the pandemic, and I know that we're 4 years out of it, but it still resonates with us today in terms of the impact. So we have to be thoughtful about maintaining our culture, helping to develop our culture, supporting our people, because they're the tip of the spear in terms of patient contact. The second thing, and that's old, right? That has been around. It will always be around. The second thing that's very important is technology. I submit to you today that we are incapable of imagining the impact that AI is going to have on the field of healthcare in 10 years. And we can make predictions, but if you think back 25, 30 years ago, when the cell phone was as big as our computer, right? Today, the cell phone is something you hold in our hand, and it's 10,000 times more powerful than the cell phone or computer we had 25 years ago. Were we really capable of imagining that? That will be AI in healthcare in 10 years. We don't know what it's going to touch. But our opportunity as leaders, as healthcare professionals, is to embrace it, learn about it, think about how it can be used, use it to make care better, use it to make the lives of our caregivers better, because we can't escape it, we shouldn't escape it, and we shouldn't be afraid of it. We should learn about it, we should lean into it, we should understand how we can use that to not only benefit the people, our people, healthcare professionals, but the patients and the families that we serve, because it's going to be evolutionary to our field.
I think you are absolutely correct. So AI has got so many benefits as well, but are we really harnessing those benefits in the most appropriate way that would make the most appropriate impact for the outcome that we are looking at? I think probably it's still a long way to go. And your first point on culture of safety or the overall culture in an organization, I think that's also very, very critical, and you have very aptly pointed that right. Even as part of Joint Commission International, we have been focusing a lot on patient safety through culture of safety. But sometimes some of the organizations just want to do kind of a tick in the check box that okay, I have done this job, but it's so much beyond that. It's just so much beyond that. And when you hear people talking about it, people who really know, it's just so amazing when you understand that what all can it lead to. So thank you again, for sharing those key pointers that that should definitely be making an impact. You have been among the early global voices who started connecting patient experience with clinical outcomes. Now when you look back those 5 years, 10 years down the line, what do you think, what has meaningfully changed in how the world largely still today understands this relationship of experience versus outcomes?
I think it's better today than it was when the experience movement was really growing or starting. It was really seen as a separate silo, and it was themed around making people happy, making patients happy, making families happy. I don't think experience is about happiness. I think experience is about meeting patients and families' needs, and I think that's better recognized today. The hierarchy that I've often talked about, I don't think I invented it, but is to consider that safety is the highest need, delivering high quality care is the second, and doing it in an environment where people feel cared for, the experience, is third. But they're interrelated, right? And why that's important is because we need to help people understand how to think about it, how to improve it. At the end of the day, you could be the best surgeon practicing in the best medical center in the history of medicine. But if you make a mistake and cause a safety error, everything else around your best, your quality goes out the door. So you have to be focused on the total experience that the patients and families are going through. And I think the integration of that and the integrated thinking of that today is a leap from where we started, and it's only getting better because I do think that's how people define it.
Yeah, I think you're absolutely correct. Again, if we are staying on the topic of patient experience, a lot of times it is taken as the overall hospitality that we look at, that, you have an amazing, clean, nice room, you have great food, you have a great housekeeping service, people respond to the call bells immediately. Uh, is it that people really get confused, that and get mistaken with what experience means all about? And in your view, what is then the truest definition of patient experience, one that health systems or hospitals should actually be operating from?
I think patients view us and our performance based on things they understand. And the things that they understand are having their needs met, right? So is it important that I walk into a patient's room and I'm nice and I'm smiling? That's probably not as important as me walking into a patient's room, being respectful, of course, but making sure that I answer their questions, making sure that I help them understand what's going on in their healthcare journey. So I think that elements of the experience component is to ensure that we're meeting what's important to patients. I don't think, patients don't expect good food in the hospital. We did a study when I was at Prescaney looking at how patients perceive their food. And generally speaking, patients will say they expect bad food in the hospital. But what they also expect is what they can control, which is knowing that if they order something, they get what they ordered. Knowing that when they expect it to be served lunch, it's served on time. They don't expect it to be gourmet food, but they expect the little things to count. That's how they view us from the experience standpoint. Do we communicate with them? Do we answer their questions? Are the things that they have control over, like their food, accurate? So it's getting to understanding what's important from their perspective, not necessarily thinking about it from our perspective. So I think that the overall definition, as I said, includes this idea of delivering safe, high quality care, but in an environment where people feel, families and patients feel that you're caring for them, that you're connecting with them. You said earlier about that you made the comment about, in response to my story about my father and being on the other side. We teach healthcare professionals across the world to be detached. And we do that because we feel that if they're detached, they're more objective. Patients didn't read that medical book, right? They expect us to know something about them, because studies show that when patients think that you know something about them, then they feel that you care more about them. So we have to be able to make connections with them and make sure that we're meeting their needs.
Very well said, actually. And I think the way people need to start looking at it is a complete shift in the mindset and on protocol, systems, policies, actions on the ground. The whole thing needs to shift. The whole thing needs to change from where people are today, and then from where we want to be there tomorrow. And that will ultimately impact, it's just not about food or the room, but as rightly said, on the consent, on how I explain my procedure, how I explain the medications, how I give that right to the patient, and that comfort level that he can ask questions to his care providers. I think all these things really make a difference, as you pointed it out in your comment. Dr. Merlino, if we have to switch gears a little bit, today healthcare staff burnout is something which is real. It's been a challenge for the global community in healthcare. If you have to talk about it, or from your larger experience and perspective, what cultural shift most effectively supports caregiver well-being today, largely?
Yeah, I think it has to do partly with recognizing it. I think sometimes as leaders, we know it's there, but we're not leaning into really the empathy component that we understand it and we're here to support you. I think it starts with that, and I think from there, it's really up to leaders to work with their healthcare professionals that are on the front lines to understand ways to make their lives better. Right? I mean, healthcare delivery is hard, and I'm great at making statements that are obvious, but the stress on professionals today is much greater than it has been in the past. We need to ensure that we understand that. We need to ensure that we have ways to connect with people, and we should be looking for ways to remove barriers and to make the delivery of healthcare easier, less burdensome for caregivers. I think AI can play a role in this. You're starting to see it more with these virtual scribes that can take the burden of record keeping off of the caregivers so they can spend more time doing what they went into healthcare for, which is to care for people. But we have to be more thoughtful, and we have to lean in on more opportunities to look for ways to reduce burden. One thing I'll say is kind of interesting, is a wise nurse leader counseled me once when we were talking about implementing new things for patients. She said to me, Jim, whenever we do something new for patients, it always falls in the back of nurses. And she was absolutely right. She was right then, she's right today. We have to be thoughtful that if we ask people to do something new, what can we take away so that we don't increase the burden? If you think about the amount of time that nurses and other professionals on the floor spend with patients, it's enormous. And the burden that they have is increased nearly every year with new things that they're asked to do for patients. So we have to be thoughtful about understanding what can we do to lift those burdens away from them so that we're not overstressing them with just another thing to do.
I completely agree with you, what you just said, because I think even in our experience, you want to implement something, who's that one group that will do it most religiously is the nursing group. So
Absolutely.
just go to them and that things will be done. So I think, yes, you're right. And it's definitely a challenge, the whole burnout. We see incidents and cases happening across the world that are reported. And sometimes it's very sad to go through it, because obviously the kind of demands that healthcare, expects from all the healthcare professionals is just unthinkable. It's just that, the kind of stress that probably all of us go through at some point of time or the other. But yeah, I think we really need to look at it and see how we can reduce that. Dr. Merlino, I just have one last question. I would really want to understand and, kind of give this kind of a message to all our listeners. This is basically for the emerging healthcare leaders, people who are stepping into healthcare, people who are learning, who want to drive a meaningful change in the complete healthcare community. What is that one discipline or mindset you believe will matter the most in the future for these emerging healthcare leaders?
Be optimistic. The field of healthcare and taking care of people, helping them heal, there's nothing more important. And so as you're contemplating your career or in training for your career or just about to launch into your career, be optimistic about the future. It's an amazing field, and it's one that I'm very, very personally proud to be a part of, and you should be too. It's just incredible to be able to take care of people and help your fellow human being.
I think for all our listeners, this is a great advice, to be passionate about the work that you do and just be apt about it. I think very well put in for everybody. Thank you so much for being on this show today. And I think we really did draw out a lot from, this short conversation that we had. But I would definitely, this is not a marketing gimmick or a strategy, but I would definitely urge all the listeners to read the books that you have written, because they are very simply written and, very well put forward all the thoughts that you wanted to put forward. So thank you once again, and I really look forward to meeting you very soon, and really appreciate your time to be here for our listeners and sharing your experiences with everyone.
Thank you very much for the honor of doing this. I am so excited about participating in the conference and can't wait to see you. And again, thank you very much for the conversation.
Thank you, Dr. Merlino. Have a good day.
You too.